Hello, everybody, wherever you are joining us from in the world today. You're very welcome to this important opening event in Nursing Now's season of advocacy, which starts today, right here, right now. We're really excited to have you all here to share this exciting lineup of speakers that we have for you this afternoon, to get us all enthused about becoming better advocates. For the next approximately 10 weeks, we're going to be holding a series of events that will focus on supporting nurses to become more effective at advocating for the changes that you want to see that will lead to improved health for people everywhere. This is an unprecedented moment, isn't it, for nurses? We've been through 2020, which was such a dire year that nobody ever wants to think about it again. But from now on, we really have to focus on how we're going to build our health systems to be resilient, to be responsive, to be the sorts of health systems we want. And what we know as nurses, what the whole world knows now, is that nurses are absolutely critical to the health system. We don't have enough of them. It's been so traumatic for many nurses that many are thinking of leaving. And we as a profession have to start ourselves to think about how are we going to encourage people to come into nursing? How are we going to influence our politicians, influence the world to invest in nursing, in health systems, in healthcare, in the health workforce. This is the year of the healthcare worker, the health and social care worker. So we work as part of teams. We want investment in the whole health workforce so that we create a strong, resilient workforce of which nurses make up more than half, so that we face the future with a stronger, more responsive health workforce that's really going to address these issues we see in our world, which go beyond the pandemic to universal health coverage, non-communicable diseases, all of the problems we see in our own country. So we want you to join us. We're calling this initiative Nurses Together. And if you're tweeting about this, and we certainly hope you will, please use hashtag Nurses Together. We want as many nurses as possible to be involved in this global call for investment in the health workforce and in nursing in particular. Nurses have always been good at advocating for their patients, haven't they? It's part of what we learn as nurses. I'm now, as you know, the executive director of Nursing Now, but I'm a nurse too. And I've been a nurse practitioner for much of my professional life. And as part of that, we learn to listen to what matters to people, don't we? And to plan their care with them. And the patient is at the center of that. And we learn as nurses to advocate for that plan of care that our patient wants to have for themselves. What we've been less good at is speaking out on policy matters to politicians. We're great at speaking to each other about the things that matter to us in policy terms and health system terms, but we're not so good at speaking to politicians. And at Nursing Now, we know from some of the research that we've done that nurses often feel they can't speak in large meetings. They feel ill-equipped. They don't understand the data, they don't know how to present it, and they often feel they lack confidence to speak in big meetings. So this next few weeks, we hope will give you the chance to improve your advocacy skills. We have a toolkit which we're launching today. We're going to have webinars, masterclasses, and a call to action. And we are really hoping that you will become involved in holding advocacy events in your country. More of that towards the end of this webinar, but as we go through this webinar and you consider and reflect on what people are saying, think about how that applies to you in your setting, in your country. So you're so welcome to this opening webinar. We hope it's going to make you as enthusiastic as we all are here in the Nursing Now team. And I want us to get started now on our first session. It's my great pleasure and privilege to introduce Lord Nigel Crisp as our first speaker. Lord Nigel Crisp is my boss, and he's been a steady guiding hand throughout the Nursing Now campaign. And with Professor Sheila Clow, who will also be speaking in this webinar, he co-chairs the Nursing Now board. Lord Nigel is an independent crossbench member from the House of Lords, which, as you may know, is part of our whole system of parliamentary governance. And he chairs the all-party parliamentary group on global health. So he's an experienced politician. He was also chief executive of the NHS, which is a job nobody would like to have in England from 2000 to 2006. So Lord Nigel Crisp has been both on the receiving end of lobbying, and he's also been a lobbyist himself, and he's very persuasive in arguments. So we thought it would be wonderful today to ask him to share with all of us his experiences around lobbying. What are the risks? What are the red flags? Nigel, welcome to the webinar. Thank you very much for agreeing to speak with us today. Please share with us your experiences of being an effective advocate and lobbyist. You have the floor.
Thanks a lot, Barbara, and it's a great pleasure to be here. As you say, I'm co-chair of Nursing Now, together with my great friend Sheila Clow, who I'm delighted is going to be speaking to you later on as well. Let me start off actually just by saying, you know, as you said, Barbara, 2020 was an extraordinary year and there's extraordinary pressure around now. Let me just pay tribute as a non-nurse, a non-clinician, to the nurses and health workers everywhere around the world to whom we owe so much. And it's in that context, isn't it, that we need to be thinking about this whole program of advocacy and raising our voice. Nurses Together. That's a great title, isn't it? And fantastic. I've just been flipping through the chat scene and see that we have representatives. I think the furthest east at the moment is Bangladesh, Sri Lanka and India. And the furthest west, I think, are Uruguay, US and Canada, though I've seen people from the Caribbean as well. So this really is Nurses Together around the world. It's an important session. It is important that nurses are visible and their voices are heard, advocating for patients, but also for other important issues, including, of course, more nurses and more investment in nursing. Let me start by saying advocacy is different from protesting and complaining. It's actually quite an important point here. There's a time for protest, there's a time for complaining. Sometimes you have to shout. Now that's not, you know, within professional boundaries, let's be clear about your protest. Sometimes people aren't listening, but actually advocacy is much more like persuading. You're negotiating, you're building a relationship. So think of it in those sort of terms. It's no good just saying this is how it is, you've got to do something. Actually, you need to be talking to people. I was a chief executive of the biggest health system in the world, and I got people advocating to me every day, even at weekends and all the time. So I've got some experience of maybe what worked. There is a video I know on the pack that Barbara is going to be introducing, which has 3 tips from me. I'm going to repeat those, expand them a little bit with 2 extra tips. So let's start at the beginning. So let's start with one, which is credibility. What's your credibility? So I'm the chief executive, or whoever you're trying to advocate to or lobby to. Why should I listen to you? Bear in mind, as I say, I've got renal patients talking to me about the importance of renal medicine. I've got pharmacists talking to me about things. I've got people saying, actually, HIV/AIDS is what we've really got to focus on. So why do I listen to you? In the end, I listen to you because you demonstrate your credibility. And your credibility is because you know what you're talking about. you're probably talking from personal experience, you've got your facts at your fingertips, and you know what you want me to do. You're not just coming to complain, you're actually saying, look, this is the situation and the problem, and this is the solution. And I'm afraid my phone is ringing now, but I hope my wife will pick it up. You've got everything happening that makes me believe that you're somebody who's really worth listening to. And you've got to be able to explain very clearly what it is you want, and whether it's, I don't know what it could be. It could be a change in rotas. It could be the use of cannabis. I saw in the chats, the medicinal use of cannabis. It could be about advocating for your patients. It could be about increased staffing or better conditions or better care for mental health patients. These are all the sort of things that people come and advocate for. So have the facts be credible. And the second thing I want to just mention is context. Really important in terms of context to think about what it is you are doing. Position yourself. You're in the position of, as Barbara said, advocating for your patients is part of your professional role. Really important role that you are able to speak for people who sometimes can't speak for themselves. But argument, and the arguments you put forward, mustn't just be about special pleading. You know, I'm a nurse, pay me more. You can imagine every other profession under the sun uses that argument. It's not just about special pleading. There's got to be a reason for why we should do what you want us to do. And in most cases, that's positioning it in terms of being good for patients and being good for health. You may have noticed the strapline of our campaign is improving health globally by raising the profile and status of nursing. It's not raising the profile and status of nursing, it's improving health globally by raising. We've given you a reason why I'm talking to you about how important it is to have nurses on the board everywhere. So position yourself within that wider context. Third really important area is have allies. Because actually, who else is on your side? And I know, Barbara, it'll come up later on, I believe, the idea of doing a sort of power analysis. Who's got power around the decision that you're interested in? Who's going to be in favor of, let's say, nurse prescribing? Who's going to be against nurse prescribing? How do you confront the arguments of the people against it? How do you make allies out of the people for it? Really important that you do that. And it's not just seen as nurses against the world, but that you're part of a wider movement, and you're not attacking doctors or anything. You're part of a bigger picture, and you are you're explaining why this is important, and you've got allies speaking for you as well. And very importantly, doctors and patients are the biggest allies you should be going for. I remember when we introduced nurse prescribing when I was chief executive in 2003. I was lobbied by doctors as well as nurses in the main, but doctors as well. And the biggest argument was actually it's good for patients. You know, if you're a palliative care specialist doctor, let us say, you can do the prescribing, but actually wouldn't it even better if your nurse with whom you've agreed what the prescribing regime is going to be, that he is able to do the prescribing as well? Isn't that better for patients? Anyway, I was lobbied hard about it. I was convinced, and I then joined the lobby as a champion and promoted it to the Prime Minister and so on. And we got it. I won't go into the details of it, but allies are really important. In that case, doctors and managers as well as nurses and patients. Be clear about who your targets are. Are you talking to people who've actually got the power to do what it is that you want them to do? I was lobbied today by a woman trying to get me to raise in Parliament the decisions made by an independent research body. Well, I had to tell her it's an independent research body. The point is it should be independent of politics and government. I'm not going to, we can't do anything from Parliament. You've got to talk with the organisation itself. Make sure you're talking to the right people about this and build up your campaign. Timing and persistence are really important. Let me give you one really good example of this, and that's the Nursing Now campaign. Nursing Now campaign, as I say, the strapline, improve health by raising the profile and status of nursing. Well, we could have said that at any time, couldn't we? But actually, it turned out that the timing was really right for us to sort of build up a campaign to raise the profile and status of nursing. I think there are a lot of reasons why it was. We could see change happening in the world and so on. We built up our allies. We started to create a movement. We put the ideas out there and people said, hey, that's good, can we join you? We then had to line up, we our friends at the ICN, and I know we've got Erica Burton and no doubt others here from ICN, our friends from WHO, Carrie and others, we got them on board, we got some funding, we started to build up. We did articles in papers and so on. Now, all of those things are part of advocacy. Think of it as persuasion. You know, you're trying to persuade people to buy your argument, and you're in a competitive market with lots of other things. But let me just finish with the red flags that Barbara referred to. There are real dangers here. There are dangers that you miss some people out and they are affronted because you don't engage them. Really important people to join in are the communications people, the people like the great people we've got in nursing now, Catherine and Hannah, who've organised the background of this webinar. You know, those make sure you've got the comms people on board. Make sure you've actually cleared things you're doing with employers, or you know how you're going to explain it to employers. Don't get into party politics. Don't get stuck in the middle of a political fight, unless you want to be a politician, unless you want to be political about it. But there's a real danger, particularly at things like election time. At election time, you've got to lobby all the parties to do what you want them to do. You better not, as independent professionals, get stuck with one party. These are quite difficult areas. Now, Sheila is actually a proper politician, a proper, having been Minister of Health, Sheila Clow, and I've no doubt she'll have something to say about that. But lobbying is there's some really dangerous stuff. You can get yourself stuck in the middle of a gunfight if you're not careful. I don't mean that literally, I hope, but you can see the point that I'm trying to make. It can be damaged, and don't get in the middle of a fight. But remember why you're doing this, you know, and be tenacious, be persistent, use all that passion that you have for whatever the reason is. Convince me that you're credible, that you've got good arguments, and that we should be doing what you want me and us to do. Thank you very much, and good luck.
Nigel, thank you so much. As always, I always learn when I listen to you, and you've made some excellent points. We do have a power analysis map in our toolkit, and it is, as Nigel says, incredibly important. And do look at it and do think about, you know, how you'll fit it in your context. I think, you know, the advice about not to get political is something that Nigel told me when I took this job, and has reminded me, and it is so important. You know,
can I come back on that for a moment? I see there's a question saying, isn't nursing political? Nursing is political. Let me qualify what I said, which was party political. You know,
yeah.
You know, because nursing is obviously political. I just seen somebody raise that, Lisa from somewhere, and it is political, isn't it?
Yes.
In terms of it's about politics and society, but don't get party political unless you intend to, you know, and you want to be a politician, not a nurse.
Yeah.
Or as well as a nurse.
I think what you were, what I took away is what you were saying was, you know, if you ally yourself to one party, then you're going to make an enemy of the other party. So you don't want to do that if you're trying to be persuasive. I'm guessing that's the point, isn't it?
Exactly right. I mean, just be aware of what you're doing. There may be circumstances where you do want to attack that party in government, but that may not be advocacy. That may be protest. But.
Yes, quite so. So that's another interesting point. When is it advocacy? When is it protest? And these are things for us to reflect on and think about, you know, in the next 10 weeks, and especially looking at our own situation and where we are now. Thank you again, Nigel. And now, and Nigel may not be able to stay for the entire webinar. So if you have questions particularly for him, if you put them into the chat box pretty soon, I will take a look at the chat box and make sure we have a chance to ask him. But now we're going to move to Carrie Mccarthy from WHO. And Carrie and I have been doing a lot of webinars recently on state of world's nursing, strategic directions of nursing midwifery. And I am a passionate advocate for all of us reading the strategic directions on nursing midwifery and the state of the world's nursing, because that is the evidence we need right there. to be influencers in nursing. So we wanted Carrie to talk to us today about why we as nurses should be mindful of the World Health Assembly in particular, and what it is, and the evidence, the state of the world's nursing strategic directions that WHO puts out. Carrie, what's that got to do with us?
Thank you, Barbara. Thank you, and to you and your wonderful team for inviting me to participate in this really important discussion. I am pleased to share with you some of my perspectives from the World Health Organization on exactly the topic of this political lobby and the power and the potential of the lobbying and your advocacy events. I'm going to share my screen just for a few slides to illustrate what I'm talking about. I'm going to share with you an example of the successful advocacy and policy lobby campaign, and then show you 2 examples of upcoming opportunities for you to be engaged and to lobby effectively, as Barbara said. The example is the International Year of the Nurse and the Midwife, which was a decision by the 72nd World Health Assembly. So all of your country ministers are representatives of the ministry who agreed to designate 2020 as the Year of the Nurse and the Midwife, to recognize the contributions and try to optimize those contributions to health. But now that the year is concluded, although we still have lots of activities going on, we can take a look back and see the arc of this year. And actually, if we think about it, this arc was in a sense starting from advocacy and leading up to really powerful action by your countries. So we started off the year with this great level of engagement and collaboration. For example, Nursing Now, WHO, the International Council of Nurses, we signed an MOU to work together in the Year of the Nurse and the Midwife. And you all were really engaged at your country level in your Nursing Now groups and getting mobilized for this Year of the Nurse and the Midwife. And that level of engagement and collaboration and advocacy, that allowed us to produce the State of the World's Nursing Report, which was something we've never been able to do before. But as Barbara said, that really strengthened the evidence base of data and findings about the nursing workforce that you can use in your country. We also, with this, in the Year of the Nurse and Midwife, with all this advocacy and collaboration and engagement, we're able to hold the largest global meeting of nurse and midwifery stakeholders for the triad meeting between WHO, ICM, and ICN, and for the WHO Global Forum of Government Chief Nursing Midwifery Officers. So we had that broad engagement from countries, from ministries of health and stakeholder groups. And we talked about the priorities for nursing and midwifery for this year. That level of engagement really helped also with the State of the World's Midwifery Report, which will be released later this year. But again, that engagement helped develop that evidence. So it's kind of a two-way street. I think this is at the global level, but all of this is based on that interface between the actions at the national level and your engagement and your advocacy, and then what happens at the global level. And likewise, you can use that global level messaging for your engagement at the national level. But then what we saw after this advocacy and this bolus of evidence with the State of the World's Nursing Report, the State of the World's Midwifery Report, all the papers and studies that people were publishing on nursing and midwifery during this year, that strong evidence base really prompted this action at the 73rd World Health Assembly, where the member states decided to request the strategic directions for nursing midwifery, the next iteration, be brought to the 74th World Health Assembly for its consideration, where it could be adopted by a resolution on nursing and midwifery, which hasn't happened for over 10 years. So right now, that important action by the country governments, now we are in this process that Barbara alluded to with discussing with all the regional and global stakeholders, the draft consultation. on the state strategic directions, and we'll have to go with member state country governments again to finalize it. And then it will be at the 74th World Health Assembly, where your ministers of health or their representatives will be discussing it in the World Health Assembly and deciding to adopt it or not, and maybe even issuing a resolution on nursing and midwifery, which would be a really, really powerful message about countries being committed to undertake the strategic directions for the next 5 years. So this is an opportunity that I wanted to tell you a little more about the strategic directions. This is usually a technical document put together by an advisory committee and published by WHO, but it is going through the governance process. So all of your ministers or your minister representatives should be familiar with this document, which, and will be voting to adopt it. So you should also be familiar with this document and familiar with who's going to be there discussing it at the assembly. The strategic directions have 4 main policy areas: in education, jobs, leadership, and practice. And in each of these areas, there are policy priorities that are recommended for governments to and stakeholders to take up. And what we hope is that within these 4 areas and within these policy priorities, which are underlined here, that you find the relevance and most salient issues for your country, whether it be the levels of education of nurses, or retention of nurses and midwives where they're needed most, or developing that national senior government role, the chief nursing officer role, or enabling full practice or greater autonomy for midwives. We hope that within this document, this high-level document, you can find your priorities for advocacy and lobbying, but it will take some action on your part to be aware of what's in the document and try to bring that to the attention of those who are responsible in your country. The process that we are suggesting for enacting the policy priorities is this data, dialogue, and decision making as a modality for action for change. And this is what that looks like. It's sort of our theory of change in terms of having broad engagement of stakeholders across ministries, across countries, nursing now groups, regulatory bodies. That kind of engagement and mobilization at the country level is the basis for having robust data. And that data is the basis for policy dialogue. I think that's what you'd be trying to stimulate, is policy dialogue on those areas that are of priority for you within the strategic directions. And that policy dialogue is the basis for decision making. What are the policy changes that need to be made in any of the key areas for you in your country? And then the policy action that would take place. And we believe that policy action in these areas of education, jobs, leadership, and practice of nurses and midwives, that investment in those areas can and will drive progress across not just SDG 3, but SDGs on education, gender equality, decent work, and inclusive economic growth. So this strategic directions being at the assembly is an opportunity for you to be involved and make sure people your representatives are aware of what's being discussed and why it's important. And then when it's if it is adopted, then you can have this mechanism to hold them to account for their commitment in these areas. But there's another opportunity I wanted to tell you about, and that is the Year of the Health and Care Worker, which the 73rd World Health Assembly also had as a very important decision. And this is really about the continuing COVID-19 pandemic carrying us into a new phase of appreciation and respect. And it was focused on nurses and midwives last year, but really it's about all health workers who are at the forefront of the local, subnational, and national responses. And at the heart of this call is really as a call for action, that if we want to manage the pandemic and maintain health services and improve health workforce readiness and education and learning and roll out the COVID-19 vaccine, then we have to invest in health workers, we have to protect them, and we have to do this together. So this year might not be focused only on nurses and midwives, but as the largest component of almost every health workforce, it still is an opportunity for focus on nurses and midwives. And this year, the messages that you can use for your work and your advocacy and your lobby in country is about ensuring health workers are prioritized for the COVID-19 vaccine, trying to mobilize commitments from your member states. Like we're trying to mobilize commitments from the country governments, the international financing institutions, philanthropic partners to protect and invest in health workers to accelerate the COVID-19 recovery and the SDGs. So we're working to engage member states and all stakeholders in policy dialogue. So for you and your messaging, we hope that these broader messages can really help you get involved and push at your local level. So there will be opportunities like calls for research papers at journals. There'll be the UN General Assembly will be discussed and potentially have a resolution on healthcare workers. There'll be social media campaigns. There'll be a global forum for human resources for health at which nursing midwifery issues can be front and center. We'll also be technical and normative guidance for you to use. Similar to the State of the World's Nursing Report and the State of the World's Midwifery Report. So this year is also an opportunity for you to get engaged and lobby effectively, use the messages and the higher level policy arguments and commitments to your advantage during this year. So we hope to see you involved and engaged and as mobilized as you were for the year of the nurse and the midwife, for the year of the health and care worker. I'm going to stop there. Thank you, Barbara.
Carrie, thank you so much. And it's great to see already some themes emerging here. You know, Chris talked about engaging stakeholders, and in your theory of change, that's kind of front and center, isn't it? We need to get the stakeholders on board. We need to have the data. And our toolkit is designed around the strategic direction. So it's got jobs, leadership, you know, your 4 categories are the framework, because what we want is for people to see the relevance of that big global picture to their own country.
Exactly.
And you know, that is so important. There was a question for you here, Carrie. If I'm going to ask it now, because I know that you have to go, it's from Pat Hughes, I think, says, who's well known here in the UK. And she says, have these strategic directions been evaluated in previous years? And if so, what has been learned that influences the new strategic directions? Good question.
Yeah, so the strategic directions have been developed by WHO since 2002, and they're usually a 4, 5, 7 to 7 year period of time. To my knowledge, they're, you know, in terms of a formal evaluation of the implementation, the one I'm most familiar with was undertaken in 2018, which was the midpoint of the 2016-2020 strategic directions. And we looked at the levels of implementation of those different policy priorities. And that strategic directions was a little bit different. There were a lot more policy priorities that countries can choose from. But we did have a mechanism, actually using the same mechanism that we proposed for the current draft strategic directions, which is using that global forum of government chief nurses and midwifery officers and the triad meeting of ICN, ICM, and WHO to ask directly what has been the progress in each of these policy areas. So that's the mechanism we're also proposing as one part of the monitoring and accountability framework for the current strategic directions, as well as country Ministry of Health reporting on the nursing midwifery workforce using those specific indicators that were in the State of the World's Nursing Report and the State of the World's Midwifery Report. So we'll actually have annual reporting on those every year from countries, as the global forum of all the nursing midwifery leaders and stakeholders to get a sense of what action has taken place in country relative to those 11 key priorities that are currently in the draft. And that will be every 2 years that we'll have that policy sort of marking at that point.
Fabulous, because that really links to our toolkit, you know, on our web, in which we say, how does this apply in your country? So if you apply the labour market approach to your country, what would be the picture? Do you know what it is? You know, do you know where the data is? And that's why it's important to know that, because it does feed into the global picture too, doesn't it? You know, and understanding all of that process, I think, is part of how nurses become more astute as policy influencers.
Absolutely. Mm-hmm.
So that's great. Thank you so much, Carrie. I'm just desperately here trying to look to see if there's other questions coming in. I'm not very good at multitasking, well, for a grandmother. So I'm looking to see if there's any other of these come in, but I think we're okay at the moment. So thank you so much, Carrie. We really appreciate that you took the time. And now we're going from the world to Scotland and to my buddy, Claire Cable, who is, are you Executive Director or CEO of Queen's Nursing Institute Scotland?
Indeed, Chief Executive and Nurse Director.
Yes, and the Queen's Nursing Institute focuses on what we call in the UK district nursing or community nursing. And Claire has been leading some wonderful sort of leadership focused initiatives for young nurses through the QNI Scotland. And we were talking with her recently about advocacy at a more local level. So we're going from the world to Scotland. And Claire, please share with us some of your experiences. Thank you.
Brilliant. Thank you, Barbara. And absolutely delighted to be here from a freezing cold Scotland. It is the winds are blowing and it's snowing and it's it's not warm. However, it's a great delight to be with you. As Barbara said, I just wanted to share some of the things that we have learned on our journey, maybe around influencing locally. So thank you so much, Carrie, for the big picture, the global overview of advocacy for nursing as a profession. But I think, as Nigel rightly pointed out, we need to be advocates at every level. And part of that is about getting really good at telling your story. Don't underestimate how powerful the story of the extraordinary everyday things that you do as a nurse are to other people. It may feel like the day job to you, but to others, it's so important that we communicate our knowledge and skill and expertise and our impact as nurses and midwives to really paint the picture of contemporary nursing expertise and the impact that has on improving health. Just this morning, I was on a call with two very senior police officers in Scotland who were the head of the violence reduction unit. And they had been working alongside an extraordinary community nurse who works in homeless outreach. And they described her as a force of nature. And because of the work that she was doing, they were advocating for nursing and community nursing far more powerfully than I could have done. So don't underestimate the power of telling your story locally, so that others hear it and others can be advocates for nursing and midwifery as well. In Scotland, whilst of course we are in the middle of a global digital revolution in terms of the way people communicate, actually one of the most important and effective ways of communicating is through local newspapers. They are still incredibly widely read. So find the communication channels in your area. Where are those places that you can tell the story of nursing and midwifery, the stories of that impact? Local newspapers love good news stories. And if you can provide copy-ready stories with photographs, they will, bite your hand off. And they're a very powerful way of telling others about what we do. And so when elections come and people are asking, what are the issues we should be voting on? Well, supporting investment in nursing workforce makes sense if people in communities really understand what it is that that nurses across the board are doing. So the more we can communicate our impact and our how it is that nurses are improving health, the more it is that we will get that public support. And when it comes to influence through elections, people will understand what it is that we do. Somebody earlier mentioned communications professionals and communications teams. I'd just love to kind of reinforce that message, because most employers will have communications teams. So build your relationships with them, tap their expertise, because that's what they do. They are great at helping us tell stories, but let them know who you are. So when they need your clinical expertise, your input, they know where to come. So build those relationships, because those people are a great source of expertise, but also really important people to have good relationships with. And nursing organisations as well, the professional bodies, wherever you are, your membership organisations, they will have policy and parliamentary teams. Again, a great source of expertise, but let them know where you are. So when they need somebody to speak about primary health care or midwifery or working with people with learning disabilities, they know who to come and find. They already know you're there. Make sure you're on their radar so that they can contact you at the right moment to speak. And parliamentary process, again, really important to understand. Wherever you are, understand the processes and how you can get involved. As a citizen, you can respond to consultations, but equally to connect with others and act collectively and have your voice heard through your nursing organisations. But when you understand the processes and the issues and the stages of legislation, then you can influence really effectively by connecting in with others and making sure that your expertise is there in supporting the writing of briefing papers for members of your assembly or parliament. So just find out who are the people you need to connect in with. That's probably about my 5 minutes, isn't it, Barbara? But I just wanted to say, you know, that message of investment in nursing workforce, it needs to be heard everywhere. So get really good at telling the story of what it is that we do and the impact we have on health, and make sure your member of parliament, your local councillors, your local police officers, whoever it is you link with, just keep telling that story because that is how we will win hearts and minds and ensure that that investment in the nursing workforce, in education and leadership and jobs is heard when people really understand what it is that we do. Thank you.
Thank you so much, Claire. And you've hit the nail on the head there. It's hearts and minds, isn't it, when you're trying to persuade people? You know, you've got to engage their minds with the data and all the facts and, you know, all of those hard things. But you've got to engage their hearts as well. And, you know, that's when we change, isn't it? When our hearts and minds are engaged. So really important. And there's a lot of support, Claire, in the chat for the idea of storytelling. And I just want to share one that's come in from Vicky Phillips while you were speaking, who I think is in Canada. She said, "This is wonderful, gives me hope in staying with the profession. We need to get better at supporting and encouraging one another." And I think that is so important. You know, this is about nurses together. We share our stories for each other and we share them to be influencers as well. Claire, thank you so much. Lots of very wise advice. I love being in contact with local media. So critical, isn't it? You know, it's another place to tell our stories, to show the data, and to have some influence. So, Menashe Nika, who has been our young board member for this campaign, And Menashe has come from, I think you were working in South Africa, and now you've come to London, I think, which is not nearly so warm or flowery at the moment, sorry. But welcome to London, and we're so delighted to have you join us. And Menashe is going to take over from now, chairing a panel discussion that involves some more of our board members and critically some of our young nurses, Miriam and Danu, Iriana Perez. Miriam's from Kenya, Iriana's from Mexico, and Sana Gul, I think is on from, I hope is still here. Yes, there you are, Sana, from Pakistan. And at Nursing Now, we really, really believe that leadership is with everybody throughout the nursing profession, especially our young nurses. So you're very welcome. Menashe, over to you.
Sure. Thank you so much, Barbara. And I think it really is exciting to really have this webinar and to be on this call. Particularly, I know with my other young nurses as well, the other young colleagues I have on this webinar as well. I know we're really excited to be able to listen to the speeches we have today and the panelists we have today. And it really is exciting to be able to learn, particularly like from the talks that we just had right now, about advocacy being about building relationships and really creating that relationship with the people we are advocating to. And also being able to learn a lot about telling stories. And I'm looking forward to a lot of stories and the questions that we're going to share this afternoon with our young nurses, and being able to ask our panelists and get their advice and guidance on it. So my name is Menashe Nyika. I'm a young nurse from Zimbabwe, and I'm currently in the UK doing a course on systemic anti-cancer therapy. And I am joined with 3 other young nurses. That's Miriam, Iriana, and Sana. And together, we're going to be asking our panelists on advocacy and really getting their wealth of knowledge and experience with advocacy and being able to lobby. So our panelists for this afternoon are, our distinguished panelists are Professor Sheila Tlau, who is the former Minister of Health for Botswana and the Nursing Now co-chair. Nice to see you, Prof. Sheila. We have Adela Zabelegui, also on the Nursing Now board. She's Vice Director of the Nursing Research and Teaching Hospital Clinic. That's in Spain. Nice to see you, Adela. And we have Erica Burton, Senior Advisor of Nursing and Health Policy with the ICN. Nice to see you, Erica, and really looking forward to being able to hear from you all and being able to learn a lot this afternoon. So without further ado, I'd like to hand over to Professor Sheila and really just tap onto your wealth of knowledge and experience as former Minister of Health of Botswana. I think there's a lot that you're going to be able to share with us and really looking forward to learn.
Yes, thank you very much. Thank you, Menashe. And good afternoon, good morning, good evening, wherever you are. I'm just excited to see so many people in here. And I even got to see somebody who is in Wagga Wagga, Australia. I'm thinking, well, shouldn't they be sleeping? But it just shows how excited people are to be participating in this. I'm right now in Botswana, is thundering outside, but I'd rather be right here with you than outside watching the lightning or whatever. So anyway, I'm the co-chair of Nursing Now, together with Lord Nigel Crisp, who just gave a very great presentation. Just, he was the first speaker. So I'm, having been a Minister of Health, let me phrase it first to say, okay, he talked about demonstration versus persuading and negotiating. And I have to say, I have been both. I came from a civil society upbringing in that I was a nurse, but because of my gender activism, I then decided that I'm going to be lobbying for women's rights so that when HIV, hit Africa and Botswana in particular, I then became a gender and HIV activist. Now, when you are like that, you have to, at one point, be demonstrating. And yes, I used to be one of those kids who would trash the stores of the pharmaceutical companies because they did not want to lower the drugs for HIV. So there was no persuasion, there was no negotiation. It was straight point, lower the drug prices or don't even be at this AIDS conference. But in there was also the nursing part, the professional, so that I was able to negotiate and have quite a number of laws changed for women, including that's myself, that's fellow nurses who are female, and of course that's women in general. So that when we went to the Beijing conference, I was actually one of those nurses who was presenting on the laws that discriminate against women and in general, and how they impact on the health status of women. So that for me, therefore, it was that. And it was actually that activism that then led me to being a party animal, a party like politician, being aligned. Because, with us nurses, we have that phrase, being a professional. One of the qualities of a professional is that you should not align yourself with any one political party. No, actually it says apolitical. And sometimes nurses don't understand what apolitical means. They think it means you shouldn't even say anything, anything that you do will be termed as being for some political party. And I had to even teach my own students to say, it means don't align yourself with any one political party. But your profession itself is very political. And you have to ensure that you negotiate, you persuade, you lobby to ensure that things become right. So, however, I later myself aligned with the ruling political party in order to really now penetrate and ensure that if I want the president, I get him right away. And that's how I then became a minister of health. Now, having had that experience, let me be the one to then tell you how decisions are made, in terms of health, like, how are decisions made in the political arena. The first thing is that health is inherently a political choice. You may have a political party that is ruling, but that doesn't care anything about our health. But you may have one where when they went in, they promised the whole population that we are going to improve the health of everybody. That way you know now how to go in. But the end product is that data is very important. When you have that access to the person that you are going to be lobbying, data is very important. For us in nursing, the State of the World report, it has been a very good source of persuasive data. But what I've seen some, nursing organizations do have been to take their country report and just throw it to politicians to say, there it is. That's not the way the political mind operates. There are so many things that cloud you that you don't have time to be reading a 10-page thing. No, the thing is, if you want the politician to read it and be able to lobby for and with you, is to condense all that into 2 or 3 pages. Politicians are not that smart. We don't read anything more than 3 pages. So I used to just say that to even, my nurses, I'll say, look, I want to lobby so that, we have a salary increase, but of course, for all health professionals, but go and give me 2 pages that I can be able to talk to the president about and to see how the Minister of Finance then reacts. So what I'm sharing with you is to show that I guess in any one country, the last person, the last decision maker is really a president. When you go to the minister, they also have to lobby, another person. Sometimes the Minister of Finance, sometimes the Vice President, and sometimes up to the President. So they may have 2 or 3 other levels of lobbying. It doesn't end just with any one minister or any one member of parliament. So, but therefore, as nurses, we need to have access to data at the right time. Lord Nigel did talk about how our data was actually at the right time because of what was happening in the world and the fact that now people were aware that health is very important. Health is the one thing that in a lot of countries has been taken for granted. If you look into your country configuration and you look at the ministers, let's say when the even greeting an incoming guest or a president of another country, the Minister of Health is usually one of the last at the end. They go according to seniority, you know, Vice President, Minister of Finance, and then they go, and usually health, you know, there are like maybe 4 other ministers behind you, but it's usually taken that for granted until something becomes an emergency. And sometimes it may mean that you then take that emergency to say, look, we have data here on how we can improve this health status, but it simply means that we need more nurses who are educated. We need ways of retaining them, promoting them, and ensuring that they are at leadership positions. So let me simply end because I know I'll have questions. I'm gonna share, I'm sure I've taken enough. How many minutes do I have?
No, that's fine. We really enjoy being able to listen, and I think we can be able to continue going on.
Yes, no, I wanted that's just one thing to say that you know, in the ultimate, we can have access to members of parliament. Remember, as nurses, we also vote. And usually we are so good because we're such good citizens, but we actually go to vote. But the very person that you're voting for, the member of parliament, should be your ally. That's the person who should be that champion who can be able to be approached and champion the needs of health at parliament, or and then also to see how they have access to the ministers and all that. I know it's different in some countries. I mean, I visited some countries as regional director. I've been told we don't have access to the minister. And you are thinking, why? He's a political person, there should be for people. But then, you know, in other countries, access is very easy. But when you have that access, it simply means getting there and knowing that this is the way, you know, we have to have a process. The data, that political and policy dialogue, and then how it's going to be implemented. So, but in my ending, I want to really just say, we need more nurses as politicians, as decision makers. It was not easy for me being a nurse and really, you know, being for nurses. I had to be for every health professional. But what then happened was I influenced other nurses to participate, to join politics, and actually now become very political. And guess what happened? When I was minister, a few years later, there were 2 nurses who were mayors of big cities. And these mayors, the cities were so great. We saw a lot of progress where even school children, you know, school health was so improved and all that. So that it just shows that when a nurse leads, a lot can happen. I'm hoping that those of you who had, as I'm talking, those of you who had any doubt in your minds as to whether, you know, you should really join politics or what, please do. If there is any inkling, don't listen to that voice of no reason that is saying, oh no, you don't think politics is dirty. Politics is dirty, somebody has to do it. And it can only improve when somebody who has the heart of a nurse is right there helping to make decisions that are people-centered and that will go a long way towards achieving universal health coverage. So thank you very much.
Sure. Thank you so much, Prof. Sheila, and really being able to give us that picture of the politics and really the structure of the politics and how to be able to understand how to, in being able to advocate, how to look into and strike that balance between being apolitical and being political. So yeah, that's really amazing and really great to be able to learn, particularly from you as a former Minister of Health, who has been directly at the front line of being able to receive lobbies and being able to lobby as well. I know, particularly in Botswana during your term, that was one of the best terms that Botswana had with you as Minister of Health. So it's really inspiring to be able to listen from you this afternoon. I'd also like to then bring in our next speaker for this afternoon, and that's Adela, who is a Nursing Now board member, fellow Nursing Now board member. And Adela, really just to tap into your experience as well and really get your views, particularly on being able to be an advocate and advocacy in lobbying.
Thank you very much. Greetings from Barcelona. It is a pleasure to share with all of you my view about the elements that are important in the role of nurses in advocacy. So healthcare is having a tremendous pressure right now, and we have new demands, not only from COVID-19, but also from challenges confronted by chronic diseases or population aging. And because of that, many countries are rethinking healthcare. And in this context, I think nurses could actively participate and in many cases become reform agents. Our professional responsibility in healthcare includes using our voice as advocates for our patients, for citizens, and also for healthcare system. We know what needs to be changed. We know what can we do as well. And I want to emphasize 3 different areas. The first one is that the role of nurses as advocacy is based in our competences. As Sheila mentioned before, and Barbara as well, this is our major element, is our knowledge and also our expertise that nowadays is in high demand. Competencies such as management, case management, facilitating access to care, care coordination, patient and population education, health promotion, disease prevention, public health intervention, and transitional care are essentials to reform healthcare that moves from acute care towards placing a higher emphasis on prevention and management. The evidence of nursing effective and efficient outcomes is clear. For instance, nurses-led clinics provides a safe, accessible, and affordable care. Therefore, nurses, together with other health professionals, have a new opportunity to drive change and shape the health of the future of healthcare, by focusing on health promotion, disease prevention, care integration, and coordination. So the main element is our knowledge and our expertise. But besides that, and despite all the efforts to get a seat at the table where decisions are taken, it seems like other health professionals, like physicians, get all the attention and nurses are left behind. The good news is that nurses, all of us, we are trusted voices, have gained public support, and have the commitment to healthcare improvement. So now is the time for us to engage in the policy development process, becoming relevant players in the political arena. Nurses need to be aware of policy and its impact in healthcare. And in this regard, we need to put aside the differences that divide us in the past and speak with a unified, professional, and confident voice. We need to work together. Much more needs to be done. Let's work together to set priorities and make a wide-reaching improvements in patient care, in health, and in healthcare system. And the last element, the third element that I think is very important is nursing leadership. Nursing leadership is essential to assure that the voice and the wisdom of the largest healthcare group of professionals is heard, and that it is present at all points of care and in all transitions, contributing to the transformation of healthcare system. Leadership begins at all levels, like Sheila mentioned, from the bedside to the boardroom, to the Ministry of Health, and to the Parliament. It will be great to achieve that all countries have a chief nurse officer working effectively for better health for all, not just a title, but competencies based on roles and responsibilities. Nurses need to be full partners with physicians and patients in healthcare decision-making. All stakeholders must be involved from my point of view. Nursing participation in decision-making has to be taught at the basic nursing education and also at the highest degree. Young leaders need to be mentored, and care actions coalitions that includes patients' voice need to work together with educating policymakers and other decision makers. Moreover, we need to seek financial support and engage the media to increase the visibility of public nurses' expertise and move key recommendations forward. We know what needs to be changed. We know how to do it. Now we have to do it together. Thank you, Michelle, for inviting me to participate in this panel.
Oh, thank you so much, Adela. And I think your message really resonates with our hashtag of nurses together, and really being able to push that message across. And it's really inspiring to be able to talk to you. I know as a Nursing Now board member, you've really been at the forefront of pushing across this message. So it's really amazing with all your advocacy work and all that you do. So thank you so much.
Thanks to you.
And I would like to bring in our next speaker as well, who is the Senior Nursing Advisor for Health and Policy in the International Council of Nurses. That's Ms. Erica Burton. Erica, looking forward to being able to listen to you and being able to learn from you this afternoon.
Thanks, Manashi. Hi, everyone, and thank you to Nursing Now, to all of the speakers. Has been such a great conversation so far. So I'm the Senior Advisor at ICN, and really the heart of ICN's work is advocacy. So I'll talk a little bit about sort of my perspective as a nurse who has been working with ICN now for over 5 years, and who has actually seen quite a drastic development in how nurses are engaging and becoming engaged from right down from the student level all the way up to senior leaders in advocacy, and sort of what that looks like. What I find interesting was that I've heard a lot about that we nurses aren't good advocates. We don't have experience in it. We need to grow. I think that's true, but I also think that if we dig back to our roots and our history, we can see some really good examples. So we shouldn't underestimate that. ICN was actually born and raised really at the intersection of the women's rights movement. And when people were coming together to reform healthcare and to fight for social progressivism, nurses were there and were speaking up. The nurses who founded ICN were deeply engaged in advocacy work, and that was around the International Women's Movement. So some really good examples of advocacy in our history. And really, it was this fight for women's rights and then also the development of organized nursing that brought together ICN's founders. And then ICN was born in 1899. So really throughout history, nurses have made a tremendous impact in advancing the profession and in advancing health and well-being by advocacy, by advocating for issues that are important to nurses, that are important to our patients and our communities. In order to create effective policies, we all know that it is absolutely essential to have nurses involved, sitting at the policy table, being involved in the policy process. And if we don't advocate for nurses as nurses, we absolutely can't expect anyone else to. But we do have a significant impact and influence on policy making. And I think that the speakers today have all shown excellent examples of advocacy and how we have been and will continue to make a big impact. We are in a very strong position to advocate for change. And that comes down to a number of reasons, many of which have already been mentioned over the last hour. First being that we are the largest group of healthcare professionals in the health system. So that is a powerful force. That is a big number of individuals who can affect change. We're the backbone of health systems. I think that the COVID-19 pandemic has shown that more and more clearly to the world. We also have the evidence, and we are trusted. And so these two pieces give us that credibility that Nigel spoke about. I will also mention the fact that we are close to patients. So this closeness gives us these unique insights into a variety of issues that we have quite a privilege to have, and that closeness and that trust and that therapeutic relationship that we build gives us this into issues that are really at the basis of why we want to make policy change. And so policymakers can really learn from our expertise. And our stories, as we've heard several times over the past hour, can be transformed into policies. Claire also mentioned stories, and I think funnily enough, we all prepared for this webinar separately, but we all seem to be on the same page, which I think is fantastic. And plus, I've seen a lot of mention about stories and sharing stories in the chat, so that's just great. Really at the heart of advocacy is connecting with lived experiences of people and then leveraging these lived experiences and these stories for policy change. The ICN has our International Nurses Day campaign that we do to celebrate International Nurses Day on May 12th every year. And this campaign has done so well in recent years in connecting people, both in nursing and out of nursing, with stories. Which are typically nurse-led initiatives that sometimes push boundaries, but also that really clearly, with a sense of realness, showcase the skills of nursing. It showcases nursing's knowledge and our abilities. And it makes that human connection to the evidence that we've heard about is so important in advocacy. And that builds a strong case for nursing. I think that 2020 is the year of the International Year of the Nurse and the Midwife presented such a unique opportunity to clearly show policymakers the value of nursing. It showed other health professionals, it showed the public just what contribution nurses really make. There were a lot of myths that were broken down in this year and stereotypes. And it really brought to the forefront what are our skills and what is the knowledge that we need in this profession. As Carrie mentioned, 2020's advocacy activities have now developed this evidence, which is turning into action. So now through 2020 and into 2021, we've seen this sharp focus on how essential we truly are to health systems because of the COVID-19 pandemic. Plus, the world is starting to see what we really need in order to take care of the global population. So we've seen, violence and attacks against nurses. We've seen lack of protective equipment. We've seen long working hours. And I think that value of nursing plus what we need to do our jobs is in a clear focus. So we find ourselves in a time where advocacy has never been more important, and perhaps will also be more effective than it ever has been, because all eyes are on our profession. So I think that this year will be an extremely important year for nursing to fight for governments, health leaders, and employers to invest in nursing education, and nursing leadership. I'm almost, I think, my time, but I just wanted to quickly mention Florence Nightingale, considering this is sort of the offshoot of the Nightingale Challenge. She is an excellent and, of course, relevant example of a good advocate. She was clear, she was persuasive, she had a proactive approach to policymaking. Differently, she was privileged enough to be exposed to a rich network of thought leaders through her father, and she presented that evidence, and she deeply understood that evidence, and she gave it to them in a very digestible format, using a whole wide range of tools. So I hope to continue this conversation through questions. I have a number of tips on what I think it takes to be an effective advocate, and sort of how these can be used to turn our messages and our evidence and our stories into real change.
Well, thank you so much, Erica. And it really is amazing to be able to hear from you. And I think particularly with you being with the ICN, really at the forefront of lobbying for nurses, and being able to highlight and share on nurses being effective advocates. So it really is amazing to be able to hear from you this afternoon. And I know my colleagues are going to have some amazing questions that they have to be able to share. And so with that, I would like to just bring in my colleagues, Miriam and Iriana and Sana, to be able to share questions to our panelists on questions and situations, experiences that they have. So to start, I will start with Miriam.
Hello, can you hear me? Can you hear me?
Yes, yes, we can.
Hello.
Hello, hi, Miriam. Yes, we can hear you.
Oh, thank you very much. I'm very much excited to be in the part of this panel and to be part of this group. My name is Miriam Ndenu. I'm a Kenyan currently living in Australia. And I can say right now it's about almost 2 o'clock in the morning and I'm still up and awake just to be here. Thank you very much for everyone. Thank you, Barbara. Thank you, Carrie. Thank you, Sheila, all the way from Barcelona, Nigel, Munashe, and my fellow panelists. So, okay, my question at this time goes to Sheila. Considering that we are sharing the same issues in the same continent, that's Africa, and I can say you are encouraging the nurses to be in politics. As you said, politics is dirty, but to some point, according to you, dirty is good. So, and you were saying about propelling educated nurses to the top positions and retention of nurses. And okay, my question to you is, okay, considering there is this saying that goes that nurses hit their young ones, okay, my question is, what role did nurses play to bring you, to support you to the top position? Like, did you get lots of support from the nurses groups, like the colleagues, like from the professional bodies, from the union, or you lobbied on your own and used, like you used other strategies and maybe other groups to propel you to the top position?
Thank you very much, Miriam, for that great question at 2 a.m. Your time. So to say that for me, actually, I was specially elected, meaning that the support that I got from nurses was even before I was specially nominated. Because what happened was I was a professor at the university. And therefore I had students with whom I was doing research, but also an advocate out there for HIV and AIDS and gender equality. So that I had the women, I had everybody behind me. But because of my advocacy, and which of course included also really doing that demonstration, the president, the then president, decided that he needed somebody who had the heart of HIV and AIDS to go and assist, to come and assist, so that I was then elected by members of parliament as a specially elected member. And that's how I went into parliament. And once you are in parliament, I was then appointed by the president, a minister of health, so that I didn't have to then lobby the nurses and all that. I already had their support. And what I then did was to simply ensure that I was with the nurses and actually other healthcare professionals, because I had been dealing with everybody, to then be able to say, people, this is the first time a health professional has been made Minister of Health. So how do you help me? And how do I assist to ensure that we keep healthcare the way it has been? The great part was that nursing was already held in a very high, in very high esteem in Botswana. And all I did was really to continue the legacy, but to actually also ensure that we had nurses at the Ministry of Health in the Secretariat that I had to do. And that's probably the only real tangible thing that I had to do. Because, sometimes, when advertisements, you have an advert that goes, you need a director of, health services. And then it says qualifications, a junior degree in medicine, a master's degree in public health. And you're looking at this, that very thing of a junior degree in medicine disqualifies a lot of people who have a public health degree. So that we had to take that out and to say a junior degree in any health field. And that way, for all of the posts, we were able to fill in a lot of nurses. So we got to have nurses at the secretariat level. The director of nursing research was a nurse. A deputy permanent secretary was a nurse. So it augured well in that then the doctors and the pharmacists were there. They were able to work as a team and know that, yeah, this is a nurse, but director, and we're here together. So that's basically that. Thank you.
I can say thank you very much for your input. And I can say that that's a very great one, because when you went to the top position, you had the mind of all the health professionals in mind. And because of this, I'm sharing the situation in my country, whereby they can advertise for the director of nursing services position. And it's an open one. They go for the interviews, and a nurse with a master's degree and other maybe leadership and management, project management, is denied the position, and the position is given to a nurse with a diploma or with a lower training, like a certificate or a diploma. And whenever they go to that office, they serve the like the interest of the politicians, and it's like they don't have the interest of the nurses in art. Whatever they are doing is serving their own interests and doing whatever the politicians want. If they say, okay, today nurses are demonstrating, today nurses want better working environment, today nurses and the health workers need maybe like PPEs, they will go to the governor might say, okay, look here, I don't have the money. So can you tell the nurses to either go back to work or I sack them? And in fact, that whatever the director of the nurses will go, instead of advocating for better working environment, for better protection, for better retention of the nurses. And I think at that point is because it has come to a point that it's like we can't be trusted with those positions, higher positions, because they say, okay, after all, I need a person who I can manipulate. But with a person like you, I can say that you are that strong, you can advocate, you can stand in the gap, and you can say, this is what needs to be done. So, okay, but you find when I am serving someone interest, okay, I just go there behind and I'm so scared and okay, the governor said, so okay, I'll not stand because probably I don't have the qualifications and maybe I'm not that strong enough. That's why I like your character, I like your insight, I like your energy, I like your everything. As coming from Africa, where we got all the challenges, the hub for challenges, but I can say we can do, and I'm very sure nurses at one point will write a story and a story of success. Thank you.
Great.
So
thank you so much. Let me go in there. Okay. Let me go there for a while to say, thank you very much. But as you know, that puts that emphasis on the fact that we need therefore nurses to be engaged and to actually be part and parcel of the political environment and actually become active in party politics. I plan, for your information and the information of everybody here, I plan to run for the presidency of Botswana. Now that will be a real test as to whether health professionals who adored me so much will now actually lobby behind me and say, we think she can bring great improvements to our healthcare system. I've already shown how I improved the healthcare system to the point where when I left, a lot of our statistics just went haywire. They were just terrible up to today. So we'll see what happens. So fingers crossed.
That's exciting news. Menashe, your co-chair here, we're running out of time, I think.
So thank you so much, Prof. Sheila. I'd like to young nurse. Oh, sorry, Barbara.
We're running out of time, and I'm conscious lots of people have to go. They only have an hour and a half. So we may have to close it, I think. And here, sadly, I mean, nurses, we always have a lot of such interesting things to say, and we haven't got around to all of our young nurses, but we are going to have more webinars in the next 10 weeks. And we will be inviting you back if you haven't had time to speak on this one. We'll also collect together the questions, the comments, the answers, and publish them on our web pages so that everybody can have access to them along with the recording. And what I want to say to you is that we really want to collect your stories together and share them among everybody. What are you going to do? How are you going to do it? We want pictures of you on Zoom talking to your Prime Minister, talking to your Minister of Health, talking to your First Lady, talking to somebody, a champion in your country. Share those pictures with us. We're going to publish them so that everybody around the world can see that nurses together can be truly influential, truly advocate, not only for their patients, but also for their profession, as all of our wonderful speakers have said. I think, Sheila, one of the most exciting things we're going to take away from this webinar is that you're going to run for president. I'm just overjoyed. The chat is hot here. We are so proud to know you, Sheila, for so many reasons. And here's another one. But so good to see all of you. Thank you all so very much for taking part. And we look forward to seeing your pictures. Please look at our toolkit on the website. This campaign runs till April the 7th. And we will be having many more webinars, and we hope to see you all there again. Thanks again, everybody. Bye.
Thanks so much.
Thank you very much.